Hello, my name is Dr. Dusty Mattingly of Mattingly Chiropractic and Pressure Point Therapy. I'm going to go over today with you what's called the brain-body diagram. And I'm going to use this whiteboard to show you that brain-body diagram. And I'd like to introduce to you, this is Boney. Boney is a part of the office, and I used him as a demonstration. I'm not going to use him in this demonstration here, but just to have you meet Boney, okay? All right, Boney James, by the way. Okay, so let's go over what's called the brain-body diagram. All right, so I'm going to draw a couple circles up here. Up here we have one circle, and here we have another. Okay, in the top circle we have the brain. In the bottom circle we have the body. And then what connects the brain to the body is the nerves. So I'm going to draw some arrows here. And you're probably wondering why I've drawn arrows that go down and arrows that go up. Well, the nervous system is actually a two-way communication system. So I'm going to write two-way communication. I'm just going to abbreviate it, two-way comm. Okay, and over here I'm going to write the nerves. This is the nerves. Okay, so we have the brain talking to the body by or via the nerves. So the brain, there are certain centers in the brain that tell the body what to do, and then the body sends the message back to the brain and says, I did it. So like the heart center, here, sends a message down to the heart to help tell the heart what to do. And so we got the heart here. And the heart sends a message back telling the brain, this is what I did. So this is called a two-way communication system. And this is how the body works, basically. This is how the brain controls all the functions of the body. All right, so now if we have this system going uninterrupted, full communication between the brain and the body, we have what is called 100% function. All right, have you ever tried to talk to somebody on a cell phone when the signal was really good and you could really hear them, and then you were talking to that same person the next minute or so, and you entered the cell zone and you couldn't understand a word they said? Well, that's kind of like what we're dealing with here. We're dealing with 100% communication between the brain and the body, so we're going to have 100% function, okay? Now, if you have 100% function, you have what is called ease, comfort. Ease or comfort, okay? Now, let's say that one day some kind of trauma comes along, like a birth trauma or some other trauma, like a whiplash injury, a fall, a trip, somebody pushes in your back and your head zips backwards. It could be anything, stress, you come in contact with toxins that cause problems. Okay, so you come in contact with something that causes your body to go out of alignment, and the vertebrae go out of alignment, and it pinches the nerve. So the nerves become blocked to varying degrees. And that's basically called a pinched nerve. This happens, again, when the vertebrae get out of alignment. So pinched nerves. So once you've got a pinched nerve, that communication system doesn't work as well from the brain to the body, and from the body back to the brain. It will not work as well. So what do you think will happen to function? Let me show you. Well, function goes down to, 100% function goes down to malfunction, to varying degrees. Okay? And then ease is no longer there. You have what is called dis-ease. Disease. So dis-ease or disease actually means lack of comfort. That's the derivation of the word, lack of comfort. In the English language now, disease has come to mean different things like cancer or something like that. So but actually disease is derived from Latin and Greek, and it means lack of comfort. Now, you've got the brain not being able to talk to the body very well and telling the body what to do. You have malfunction and you have dis-ease. So what do you think would be the last thing to occur here? Well, let me write it down. It's called symptoms. 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 So the last phase of body dysfunction is where symptoms show up. Okay, so now, symptoms could be anything like neck pain, back pain, low back pain, pain between the shoulders, acid reflux. We can write down a whole bunch of symptoms like irregular heartbeat, carpal tunnel syndrome, sciatica, foot problems, knee problems, you name it. We're talking anything that a person could have as a symptom could result from a pinched nerve in the neck or back. Okay, so now let's look at this a little bit more. So a person who is in full-blown symptoms could be of varying ages, but many times this kind of follows a chronological age pattern where, let's say, a person is in their 20s, they have a couple of auto accidents, they get a pinched nerve, the body starts to be affected a little bit, maybe they get some malfunction, they get some dis-ease or a lack of comfort, but they really don't have any symptoms yet, or full-blown reoccurring symptoms. So they go through their 20s, they get a couple of accidents, they get their body under stress, they get some toxins accumulated in their body. They get into their 30s, they start to have more malfunction, more discomfort, but they're still able to function pretty well. They've got some more symptoms maybe. They get into their 40s, and the body just does not feel as good anymore. Like they're not as much energy. They don't recover as well from playing sports. They get some knee aches and pains that last a lot longer. Then they start to get into the symptom phase where they've got more consistent and more persistent symptoms. So they enter their 50s and they start to feel like they're older in dirt. Well, maybe not. So they get to have more persistent symptoms. I've heard this time and again from patients that come in when they're in their 50s or in their 60s that they had the auto accident back a few years ago, like in their 20s or 30s. And they really didn't notice anything until they started getting into their 40s or 50s. And then they started showing up with neck pain, back pain, low back pain, headache, acid reflux, headaches. Another big one, I didn't write that down. So headaches. So now they get into this full-blown symptom phase and they go to their medical doctor and they get put on drugs. All right, they get put on painkillers. They get worse, they get put on psychiatric drugs. They're told that it's just in your head and take a psychiatric drug. So they get a drug going. Now the problem with the drugs never back up the body to the point where it gets rid of this problem with the two-way communication between the brain and the body. Drugs never get rid of that. They just, take care of the symptoms to varying degrees, and then many times they don't even do that. But it covers up the symptoms. It never, ever heals the body, never allows the body to kind of back its way up, and get to this point where this nervous system can function properly. Never. All right, so now the person's gone everywhere, and they finally come into me, and they've got all these symptoms, okay? And I do my exam and my pressure points and all that, and I tell them, well, I think I can help you with this. So the deal is, what we're trying to get rid of in chiropractic is not only handle these symptoms, but we're trying to back the body up actually kind of back it up here to the point of removing this subluxation. This is called a subluxation. A subluxation, sub means under or less than. Luxation means a total dislocation. So a subluxation is actually less than a total dislocation of the bones of the spine that pinches a nerve. All right? So that is actually the medical terminology or the chiropractic terminology that we use to describe a vertebrae out of alignment pinching a nerve. So as a chiropractor, what we're trying to do is restore the vertebrae to its normal position so that the pinched nerve is no longer there. Okay? So as we're restoring that vertebrae to its normal position, the symptoms start to disappear. These symptoms like neck pain, back pain, low back pain, acid reflux. Yes, we can get rid of acid reflux. Headaches, you name it. We start to get this body backed up, and we start to really get that pinched nerve handled. So basically, that is what we're trying to do in chiropractic care and with pressure point therapy too, is to restore this communication system between the brain and the body. And this two-way communication system is very important for the health of the body. Because if the brain can't tell the body what to do, you're going to get all these things happening. All right? So that's it for the brain-body diagram of Dr. Dusty Mattingly. And if you have some problems with your body, call our office at 963-9050. Thanks. Bye-bye.